Hey guys, I have a great special guest today, Jason Fong, who is, you all know, he's very famous on YouTube, and he's a nephrologist, a kidney specialist. And we're here to ask a lot of questions and get a lot of great updates. He wrote two bestsellers. One is The Obesity Code and The Complete Guide to Fasting. And he wrote a new one. I think it's called The Diabetes Code, right?
Correct.
I'm
Yes.
just digging through that. It's like incredible information. I want to start just by talking about some basic things, like what is the cause of obesity? I know you talked about that many times, but
Yeah, and it's a really important question and one that really gets to the heart of how you treat it. So essentially, the cause of obesity is a hormonal issue. And there's different hormones, but the two main ones are insulin and cortisol to a lesser extent. But the main one is insulin. And a lot of people get sort of caught on the minutia, but if you look at it from a scientific standpoint, the only thing you need to know is that if insulin is what causes weight gain, then we should be able to give people insulin and make them gain weight. And it turns out that's exactly what happens. So whenever we prescribe insulin, people gain weight. If people have an insulinoma, which is a tumor that secretes too much insulin, they gain weight. If you give medications that raise insulin, such as sulfonylureas, they gain weight. The other part of the sort of causal relationship is that if you take away insulin, they should lose weight. So again, this is exactly what you see. So in type 1 diabetes, for example, where you don't produce any insulin, you lose weight. When people, type 1 diabetics, are taking insulin and they want to lose weight, there's something called diabulimia, where they actually stop taking their insulin and they lose weight. If you take one of the newer medications called the SGLT2s, they also make insulin go down and you lose weight. So every time you raise insulin, you gain weight. Every time you lower insulin, you gain weight. You can do the same exercise for cortisol, but it tends not to be as important. So again, you can give prednisone and make people gain weight. You can take away prednisone, such as the disease called Addison's disease, and people will lose weight. So you know that there's a causal relationship here. So if insulin is the main problem, then you need to focus on lowering insulin, because if insulin makes you gain weight, you need to lower insulin. The problem is that we don't focus on that. We focus on calories instead. And there's an overlap. So the confusion lies in that most foods are a combination of carbohydrates, fats, and proteins. So very few foods are pure one thing or the other, except for refined carbohydrates, where you can eat things that are almost pure carbohydrate. But for example, when you eat steak, it's a combination of fat and protein. Most meals which have a combination of all three. So there is an overlap between sort of how many calories you eat and their caloric and their insulin effect. But what it simply means is that not all foods are equally fattening, which is sort of just common sense, because the sort of lie that we've been sold is that all calories are equally fattening. So you can eat kale or you can eat cookies and they're the same. So you could eat cookies for dinner and skip your salad and you'll be fine. And any idiot would sort of know that you won't be fine if you eat cookies for dinner. And that's the real thing. So when you look at it from a real scientific standpoint, a lot of what we think about weight gain just doesn't make any sense. That is to say, if calories are so important, why doesn't your body have any sort of mechanism to measure calories? It really has no clue how many calories you're eating. If you're to reduce calories, like for low-fat diets, because dietary fat is sort of the highest in calories, so if you reduce dietary fat, you reduce calories, you should be able to lose weight. Well, guess what? Millions of people have done low-calorie, low-fat diets over the last 50 years. And guess what? The failure rate's somewhere on the order of 99%. So if we know that a low-fat, low-calorie diet fails 99% of the time, why on earth would we recommend it? It's absolutely ridiculous.
it's insane.
So it's insane. So that's what the obesity code is really about. It's about sort of saying what causes obesity, because that's the most important thing you need to know. If it's too much insulin, then lower insulin. How are you going to do that? Well, you can reduce the carbohydrate, the refined carbohydrates in your diet. You can sort of moderate protein and eat more of the natural fats. The other thing you can do is intermittent fasting, where you don't eat for a period of time, because the fastest way to lower insulin is to eat zero, which is fasting. And there's really nothing intrinsically wrong with that. But again, we get into this idea where people think that, oh, you need to eat 10 times a day. It's like, you need to eat 10 times a day to lose weight. Really, how is that going to work? How is eating more frequently going to make you lose weight? That doesn't even make any sense. It sounds really stupid because it is really stupid. I mean, it's honestly like saying you should, roll in the dirt 10 times a day to get clean. It's like, no, you shouldn't.
Yeah, exactly.
If you want to eat, so every time you eat, insulin goes up. Again, assuming that you eat a mix of macronutrients. So every time you eat, insulin goes up. And that's what it's supposed to do. That's a natural reaction. Insulin goes up and tells our body to store some of that food energy. When you don't eat, like when you go to sleep at night and when you go to sleep, insulin falls. And that's a signal that you should take some of this food energy that you've stored and pull it back out so you can burn it. So there's a balance there. When you eat, you store food energy. When you don't eat, you burn food energy. Balance the two and you won't gain weight. So if you eat all the time, you're telling your body through insulin to keep storing food energy. And that is not going to make you lose weight. It's going to make you gain weight. And that's, in fact, exactly what we see. So from 1977 to 2004, for example, we went from people eating 3 meals a day on average to about 6 meals a day. The most recent studies looking at people suggest that they eat for about 14 to 15 hours of the day. That is, and it tends to be shifted to later. So if you eat at 8 a.m. breakfast, for example, you don't stop eating until about 10:45 p.m. Mm-hmm. So essentially, the entire day you're eating, as opposed to 1977, where you would eat breakfast, lunch, dinner, that's it. No snacks in between, no bedtime snacks, that's it. So you're eating sort of 10 hours and fasting 14 hours instead of sort of the reverse. And this is the thing. We're not giving our bodies the time it needs to burn off this food energy that we've stored. And there's nothing more complicated than that. So if you want to lose weight, 1, don't eat the high insulin foods, and 2, give your body a chance to not eat so that your insulin levels can fall and you can burn it.
Exactly. So we have this mainstream viewpoint that we must lower sugar despite how much insulin we give you. What, from your viewpoint, high levels of insulin is it possibly more damaging than high levels of sugar in the blood?
I think both are very important. So the thing is, so now we're talking about diabetes where you have high blood sugar. So in type 1 diabetes, insulin levels are low. So if that's the case, then giving insulin is a reasonable thing to do. And we know that if you leave blood sugar levels very high, remember, this is type 1 where insulin levels are low. So you're not having any problem with insulin because insulin is low, but your glucose levels, blood glucose levels are high. That is a problem. So you need to get that down. And that's the sort of paradigm of glucotoxicity. That is, if you have high glucose in your blood, it's going to cause damage. What we haven't recognized is that if you have high insulin levels in your blood, it's also very damaging. So in type 2 diabetes, it's a completely different situation where you have high insulin levels and high glucose levels. So both are bad, but if you simply take more insulin to lower your blood glucose, you're just trading toxicities. That is, you're taking more insulin, so you're having more damage from the insulin, but your glucose is better, so you're having less damage from the glucose. So more insulin toxicity and less glucose toxicity. In the end, it's a wash. So you're not actually any healthier. And that's all the studies that we actually proved this exact point 10 years ago. So 10 years, we're still doing the same thing. Even after there was the Accord study, the Advanced study, the VADT, the TICOs, like tons of trials that have shown that taking more medications to lower your blood glucose doesn't make you healthier. And that's the whole point, because if your insulin levels are high anyway, why would you take more? It doesn't make any sense. You should, in fact, lower them, and that would be the proper treatment. Because, again, if you have hyperthyroidism, like if your thyroid is overactive, you don't give people more thyroid medication, right?
Right.
If it's low, you give thyroid medication. If it's high, you don't do the same thing. So if your insulin levels are low, give insulin. If your insulin levels are high, lower it. But what we did was we gave more.
Right.
That's crazy. That's crazy.
Yeah. And then, so there's kind of an omission here, like traditional medicine does not necessarily jump and test fasting insulin levels, do they?
Fasting insulin levels are quite variable, and that's one of the problems. So it fluctuates quite a bit. And in the late stages of type 2 diabetes, sometimes you see sort of a tapering off of the high insulin levels. They're still high, but not as high as you might expect. I think that what has been unrecognized is the sort of problem of too much insulin. So obesity is a problem of too much insulin, but type 2 diabetes also is a problem of too much insulin. That's sort of unrecognized. So getting a fasting insulin level, I do that regularly to make sure I'm not treating a situation of where I think it's type 2 diabetes, but it's actually a situation of type 1 diabetes where insulin levels are quite low. Because again, you have to know what you're treating, because you can't treat them the same. You can't treat low thyroid and high thyroid with the same treatment. It doesn't make any sense. It's like saying, a washer and a dryer, like one makes it wet and one makes it dry, right? They're totally different.
Right.
They're the same thing.
Exactly. Was there a point in your career where you had this huge shift of like, wow, we're doing this backwards? What this aha moment when you?
Yeah, it's about 10 years ago. So those studies came out. So I was trained quite conventionally. And 10 years ago, the conventional thinking in type 2 diabetes, so I'm a kidney specialist. I deal with a lot of kidney disease, the most common cause of which is type 2 diabetes, sort of by far and away. So I see a lot of type 2 diabetes patients, and the classical teaching was that you give as much medication as you need to get that blood glucose down, because the only thing that's important is that blood glucose.
Right.
And so that's what I did. I gave people lots of insulin and got their blood glucose as low as I humanly could. The point was in 2008 when all those trials came out that said that, hey, giving lots of insulin to get the blood glucose down doesn't actually make people healthier. And that was when I started thinking, wow, that's a total change of everything that we had been taught. Like everything changed. But unfortunately, sort of what happened was that the specialists and the universities, they just kept teaching the same thing. Give as much medication as you need to get the blood glucose down. And I kept thinking, well, isn't that exactly what we proved to be untrue? And it was very strange to watch this. But the problem is that people were so deep into this paradigm of just get the blood glucose down, that they never stopped to think about what was the problem. And that was when I really started thinking, well, there's another problem too. And my patients had recognized that long before I recognized that. So you got to recognize that type 2 diabetes is a reversible disease. Okay, so if you lose weight, type 2 diabetes almost always goes away. If you do look at studies of bariatric surgery, for example, where people get their stomachs cut and so on and they lose weight, the diabetes almost always resolves, like in 90% of cases, unless the weight comes back. So we know if they lose weight, the diabetes goes away. When we prescribe insulin to these type 2 diabetics who are older and overweight generally, they tend to gain weight. So it's like, okay, the patients would always say, look, doctor, you always tell me that I need to lose weight. Then you give me insulin, and I gain like 40 pounds. Well, how is that making my diabetes better? And I didn't have a good answer, because the answer was that it wasn't making them better. The point is that type 2 diabetes is really a disease of too much sugar in your body. When you take a medication such as insulin, it actually forces that sugar into the body. Remember, insulin is what the hormone that tells your body to store that food energy. So if your sugar is high, you take insulin, your body's going to store it. It's going to turn it into fat. So of course they gain weight. But the question is, what does it do to the sugar? Has it gotten rid of that excess sugar in your body? And the answer is no. It simply forced it into your body where you can't see it because it's not in the blood anymore. But the sugar goes all over your body. It goes into your heart and your liver and your kidneys. And over 10, 15 years, all your organs basically just rot away. That's why diabetics have disease of everything. So if you take a disease such as, say, osteomyelitis or gangrene, for example, those are diseases that are seen virtually in no other case other than diabetes, type 2 diabetes. Mm-hmm. The question is why? Why do you get this osteomyelitis, infection of the bone, which is very rare elsewhere, or you get mucormycosis, which are these rare fungal infections? Because you got way too much sugar all over the place, and the bacteria love that. So they're just happy to proliferate, and then you get a bad infection. So the point is that if you take insulin, you're not getting rid of the sugar, you're simply moving it into your body, and eventually if you stop taking the insulin, all that sugar just comes back out in the blood. So you've really done nothing for this disease, and that was the answer to why this sort of current paradigm of sort of diabetes treatment was completely wrong. If people are not losing weight, the diabetes is not going to get better. So that's where I became very interested in the question of what causes weight gain, and it turns out it was the same answer, and that's why they're related. They're both diseases of too much insulin. But it's very powerful because once you know that these are diseases of too much insulin, the solution is obvious: lower insulin.
Right.
So do that, low carbohydrate diets, intermittent fasting. Don't lower calories, because when you lower calories, you may or may not lower insulin. Like you could take Diet Coke, for example, 0 calories. Does anybody lose weight drinking Diet Coke? Not really. Like, we've been drinking it for 50 years. It's one of the top sort of 3 soda pops in the world. And clearly there's less calories than a regular Coke, but it doesn't cause less obesity. So we know that it's not the calories. Calories is not the right thing that we should be focusing on.
So you being a kidney specialist, you probably see a lot of patients coming with stage 4 on kidney dialysis and advanced stages. What has been your experience with working with some of those guys? Do some of them not need dialysis anymore?
Once you get to that stage, it's often too late. And I had hoped when I started that, yes, maybe some of them could reverse. You can reverse in the very early stages, so keep in mind that diabetic kidney disease often takes 15 to 20 years to manifest. So if you're coming in at the 18th year, very often it will make no difference. So you can reverse it when you catch it early, but when you catch it late, it's hard. It's like if you were not to change the oil in your car and then it breaks down, you say, oh, now I'm going to change the oil in my car. It's like, well, great, but it's not going to do anything for your car that's broken down. It's the same idea. Once all that damage is sustained, it's really very difficult to get it to reverse it because you've taken that hit already. So that's why I'm focused more on getting the message out and letting people know that, hey, type 2 diabetes is not an irreversible disease. It's a reversible disease. It's a dietary disease. Focus on your diet. If you reverse diabetic disease, you're not going to get the diabetic problems that you'll get later on. But if they've developed already, it's very hard to reverse that. It's still worthwhile to work with them because they're at high risk of other problems, but that kidney disease very often doesn't reverse.
What about when a patient develops a problem to the point where their potassium starts going higher and higher? And so then they go to the doctor, and the doctor says, avoid all potassium foods, including vegetables. And have you found that they pretty much need to avoid the supplement potassium, or do they have to avoid also vegetables in general because it's high in potassium? Is that an area
Certain vegetables need to be avoided. So again, this is in the relatively unusual situation where you're talking about advanced kidney disease, and there's sort of nuances in that. The kidneys are not working, they're not getting rid of the potassium. So if you take foods like avocado, which are quite high in potassium, then your body's not going to be able to get rid of it. So you do have to be careful for certain types of foods that are high in potassium, bananas, for example, oranges, mangoes. So there's a number of things that are high in potassium. So, but that is a fairly unusual situation overall. So it's a, but yes, if you get to that stage, you do have to be a little bit careful. That's why intermittent fasting works, because even if you're worried about high phosphorus, high potassium as advanced kidney disease, because you're actually eating zero, you don't have to worry about that. Your potassium intake is going to be lower than if you were to eat. And again, this is, for us, we've sort of pioneered this sort of the therapeutic use of fasting. So we have a program called the Intensive Dietary Management Program, where we help people with the fasting, because it's not fun, it's not easy, right? It's healthy, but it's hard. It's hard work. And that's what we need people to do, is get the support they need. And that's what we provide in our Intensive Dietary Management Program to people. But there are certain sort of medical things. If you have advanced disease, you do have to be a little bit careful in terms of the fasting. If you're on medications, you have to be careful and that sort of thing.